Good morning.
Good morning, Commissioner. How are you?
Good. How are you doing?
Good, thank you.
Don't know if anyone else is on or not.
They're coming.
They're coming? Okay.
Hi,
I'm
good morning,
supposed to,
Cindy.
yeah. Hi.
Hey, Shelley.
I'm supposed to give blood this morning at 11:30, so I might just have to listen in. I'm not sure how long this takes.
Okay, that's fine.
Okay.
Yeah, have fun giving blood.
Yeah. It's fun. But yeah. No, I can probably still listen in and do it even while they're poking me with needles, but
Sounds good.
yeah. I'm
Uh,
gonna turn my camera off because I probably have to be driving for a little bit and then walking into the building here in just a little bit. But I promise I'm listening carefully.
Sounds good. We trust you.
Okay, thanks.
Good morning, everyone. Thanks for being here. I'm just gonna give it another moment if that's okay. I've got some folks in the waiting room with some questionable names, but if they need to be here, I want to give them a chance to tell me that they belong here and avoid hopefully any weird Zoomness.
Always appreciate that. Thank you.
Yeah. And Josh, I'm making you co-host to share slides, correct? Okay, I think that should about do it. So good morning, everyone. Thanks for being here on a Monday. Today we're talking Senate Bill 22-235, which revolves around county admin funding. This is the funding you counties receive from the state for conducting eligibility enrollment for programs like Medicaid and SNAP. So that is obviously shared between the Colorado Department of Human Services, CDHS, and Healthcare Policy and Financing, HCPF. Thank you, state friends, for being here and all your work on this. Just to give kind of a quick overview, I'm sure you're going to go over this in more detail, but Senate Bill 22-235 has two initial work products that we'll be talking about in some detail today. The first is a comprehensive assessment of the best practices for the administration of these programs. That was actually completed last year in 2023. And then a funding model, which is set to determine the amount of money necessary to actually fund the administration of these programs in each county. So the model itself is complete, which is what we'll be talking about today. And the Joint Budget Committee will be receiving a report on the funding model come November that the state has been working with our county partners and human services directors on, or will be very soon. And that is statutorily required to be updated and resubmitted to the legislature every 3 years while considering any changes in practice or anything like that. So I think we'll be hearing 235 for many, many years to come. Jumping ahead just a little bit, for our county commissioners, I do know that the human services directors have identified this as their top, if not definitely top 3 budget priorities going into 2025. So anticipating a lot of advocacy on this front going into next year. I have a little one-pager that I've prepared for my county commissioners that are here, just giving a little bit more detail on Senate Bill 22-235 and county admin. And there are also links in there to the materials that were created from the comprehensive assessment. So I'm going to put that in the chat for you all. Hopefully it is a good reference. And I already have a question in the chat from Catherine's state friends. Are you okay sharing these slides with me? Okay, great.
Yeah, absolutely.
I will share that and the meeting recording in our next eCounty Lines newsletter, County Friends, and also make sure that that gets over to our CHSDA friends to share as well in their newsletters. And with that, I will pass it on over to our state friends.
Great. Well, Katie, thank you so much for having us today. My name is Shelley Banker, and I'm the Director of the Office of Economic Security at the Colorado Department of Human Services. And joining me today is Joshua Montoya, who's the Partner Relations and Administration Division Director for Healthcare Policy and Financing. We're going to split the presentation up today, both of us providing an overview of the total package of Senate Bill 22-235 and answering the questions that were presented, but definitely want to have plenty of time at the end for a dialogue. One thing I want to share with you is that I'm joining from Florence, Colorado at our Veterans Community Living Center, and I'm hoping that the Wi-Fi will be great for the presentation today. But if I go off camera, it will just be to make sure that there isn't a bit disconnect in actually being able to present you with the content today. So as we jump into the presentation, there were 3 things that you all asked us to present on today. And so I want to go through that agenda on the next slide, Josh, and to be able to just give you an overview of how we framed the presentation today, what you can expect. But again, if there are questions or places where you want to dig further, we are absolutely happy to do that. So the first is that you asked us to give a presentation on what did the legislation require? What was Senate Bill 22-235? So we will do that. We'll also discuss the deliverables and what recommendations have been put out to date, and then what are the next steps. So we'll give all of those answers, we hope, and if we haven't achieved that at the end, I'm sure we will have time to discuss further. So an overview of 22-235. The objective and purpose of this Senate bill was to really recognize that an important part of our services and oversight and support provided from our offices are the careful examination of the delivery of services throughout eligibility programs and throughout our counties, and the supports that are available to the counties to provide those services. In 2022, the legislature recognized that we needed a 2-pronged approach to improve the operations of public assistance programs in Colorado, and therefore initiated this Senate bill to achieve that. They knew that both financial supports for the workforce are necessary and critical, and we also need to be thinking beyond how we just hire more people to do more work. And specifically wanted to look at, are there efficiencies and processes that can be improved to better direct and utilize state funds? Senate Bill 22-235 provided funds for the Colorado Department of Human Services and the Healthcare Policy and Financing, HCPF, to contract with a vendor to complete a comprehensive assessment of the delivery of public and medical assistance programs across Colorado, and recommend strategies that could improve the effectiveness and efficiencies of the program. So that was our first phase, and I'll go into a graphic and kind of timeline of that, but that was the first phase. How can we improve efficiencies and effectiveness? And then the second phase, which is to develop a comprehensive statewide fiscal model. The first phase was completed and delivered last year, and the other is currently in the works with a November timeline. So let's just give kind of a timeline and overview, and on the next slide, you'll see that how this is laid out for both phases of those work. So we'll, throughout this presentation, refer to phase 1 and phase 2. Phase 1, as I mentioned, was completed in 2023, and that was a report that was prepared by a contractor from the department, the Public Consulting Group, or PCG. And it used information that was learned and gathered through comprehensive review of program policies, processes, information systems, and county workforces. So the consultants from PCG were looking at other states, they were looking at each of our counties and working in partnership. And on November 1st of 2023, the department submitted a follow-up report which was required by the legislation that presented a feasibility analysis of all the recommendations that came out of that report. And the report prioritized recommendations based on the analysis of both the feasibility of the systematic impact, the dependency of other work that could be accomplished, and then anticipated costs and timelines. And CDHS and HCPF fully concurred with the recommendations, and feasibility is presented in the report, and the counties agreed with much of what we put forward, and we can talk further about that. So again, all of this accomplished in phase 1 was talking about how do we improve the effectiveness and efficiencies of the system. And then phase 2 is currently underway, and this addresses county administration, which I think is probably of most interest right now to you all. We certainly know that thinking about ways to improve the effectiveness and efficiencies of our system is very important, but we also know that there is a big financial cost. We can absolutely provide in the link that Katie sends out the recommendations and feasibility report, and we'll make sure that all of that is attached with the presentation. So thanks so much for asking in the comments. So phase 2, which is currently underway, addresses the county administration. This is the funding that counties receive in order to administer the programs. And the statute directed us to develop a fiscal model for allocating resources to counties to administer those public and medical programs. Thanks, Katie. And based on the results of the model, which the model is completed, and we'll be able, Josh will present more about that today. The legislature, of course, could use that as a decision-making tool for county administration. So the model will be delivered on November 1st of this year, and then that is a tool that the Joint Budget Committee will be able to use to understand how much additional money is needed for the system and can make financial and budgetary decisions on that. So throughout today's presentation, we're going to dive a little bit further into what were those recommendations from phase 1, and then what does phase 2 look like right now. So one of the questions that you all asked of us was to share more about what exactly were the deliverables of each of these phases. Again, phase 1, we were specifically asked to conduct a comprehensive assessment of the best practices, and we looked at the landscape in Colorado, peer states. We reviewed policies and performance data, and when I say we, I actually mean PCG, excuse me. So this was done by the contractor. There were surveys with county eligibility and technicians and managers, and then visits to county offices and other capacities. So the result of that report, or the deliverable, was recommended strategies that could help improve the system overall. And specifically, we were presented from the consultants with 5 transformative recommendations, as well as 3 quick wins that could focus on improved communication and collaboration, and those are already underway. So of the transformative recommendations, I mentioned there were 5. The first was to develop a service delivery standards for public and medical assistance programs. And these are helping to align all of our standards and applications so counties could implement them. It's important to note that these standards may allow for some county discretion And there would be flexibility in the approach, but not in the core requirements. Progress in this area really helps to make sure that clients have consistent access to services and experiences, and counties have clear expectations from the entire system and state agencies of how to deliver the services. And then the state, it allows us to be able to consistently measure performance across Colorado and have those communications with our counties of how we can collectively do better as a system, what are the resources that we need. The second is that we make work accessible and portable, and specifically implementing a single statewide document and work management system. So this is something that we've been working on with the counties and through our JAI, and ultimately this will improve our customer experience and enable counties to track and manage their work in a dynamic way. The third is to improve hiring and retention strategies and practices. We know, and we've heard in partnership with the counties, that over the last several years, our workforce, it's been hard to retain. That especially goes back to phase 2 and the funding that is available. And so one of the practices and recommendations was to help to improve those hiring and retention strategies and practices. In the vendor's assessment, they found that many counties are facing eligibility workforce shortages, which I know we are all feeling. And the average tenure of an eligibility worker is 3 years, which means that there is this continual turnover where counties do not have enough resources, and then they're spending time to hire, spending time to train up those eligibility workers to get back to a full capacity. We know that salaries appear to fall considerably below living wages in most counties, depending on their family composition of the worker. And that is something that you will hear about more in the phase 2 part. So the last two of those top 5 are to optimize peak. Peak, we know, is a key component to providing seamless access for our public and medical assistance programs. However, peak's current functionality tends to can confuse our clients or frustrate eligibility workers. So that was a big focus and something that we wanted to be working on. And the recommendations that emerged from the assessment included different types of frequency of changes clients can make, simplifying change reporting, clearer navigation. So there are some really specific takeaways that our state agencies are working on. And then last, to improve policy documentation and dissemination. I know that this has been a big part of CCI and the legislative agenda is how many policy requirements there are, memos and things like that. So this was a recommendation and something that we are actively working on as well. And then some of the quick wins. So I mentioned that there were a few. One, create opportunities for the state and counties to be collaborating. We've really taken this to heart through HCPF and CDHS. And as an example, we've implemented every other week meetings where we are coming together to talk about 235, to talk about all of the different policy recommendations that came out of this and align in a way to be a better partners with the counties. I think that even presentations like this and being able for CCI to say, we want to have a learning session to get that on the calendar. These are all ways that we're really hopeful that we are practicing and moving on these quick wins that we know can really help improve outcomes, but mostly starting with ourselves and improving those relationships. Increased communication and collaboration between our agencies was the second one, and I just talked about that too. And let me finish this last one, and Lexi, I'll pop over to the comments. And third, aligning administrative requirements. So this is something too that through our strike force we've been working on in different partnerships. So Lexi asked, are the county 235 reps in those meetings between CDHS and HCPF that focus on 235? Specifically, Lexi, those meetings are our internal meetings. So really trying to figure out how we can be better partners by aligning as state agencies in our work, that then our strike force and our PAC and sub-PAC meetings as well. All right. So last, this is just to share kind of a wrap up of that phase one. The process of Senate Bill 22235 phase one was a collaborative effort among CDHS, HCPF, and the counties. I mentioned earlier that when we submitted those recommendations, the counties agreed with the majority of the recommendations. They did, however, you all did express concerns with a few of them, and that is noted in the report. We'll talk about phase two and the work that we are doing for that report submission, and the work to really include the counties throughout the process and the timeline and outline of the work. And I hope that you'll see kind of an evolution of us implementing those quick wins and practices from the first phase of the report. So we'll pause there, see if there are any questions on phase one, and then we will turn to Josh and phase two for the next part of the presentation. All right, Josh.
Thank you so much, Shelley, and good morning all. Josh Montoya here with the Department of Healthcare Policy and Financing, and I'm going to walk us through the phase two funding model. If I can get my slide deck to go, there we go. All right, so on your screen, you can see the objectives that were identified for phase two. I'm going to go ahead and leave those on the screen as I walk through what these particularly mean. So as Shelley said, HCPF and CDHS contracted with an external party to conduct the funding model work, and that vendor was North Highland. And North Highland took a specific approach in doing this funding model. So one great thing about North Highland is they had done this similar work in Oregon. So for Oregon, they had created a funding model, but the difference being is Oregon is a state administered system. So some lessons from Oregon, but had to apply that to Colorado and our county administered system. So North Highland's approach in developing the funding model included a specific set of outcomes, one of which was a peer state analysis. So we wanted North Highland to look at some of our peer states and how they do or don't do this particular set of work. And when we looked at those peer states, it was important that we had North Highland look at county administered states, because we know state administered states are significantly different. There were some state administered states that they looked at, but the majority were county administered states. And they looked at things like caseload, staffing, administrative cost across those peer states, as well as having some stakeholder engagements with those leaders from those county administered states. The other important outcome they worked towards was defining parameters. So what exactly would be included in this funding model? Things like the county workforce, demographic data, administrative workload, business processes, and technological innovations. All of those plug and play into the funding that is needed by counties to administer these programs. From there, we had them develop the funding model. So using all of their peer state analysis, their stakeholder engagements, the sort of parameters that we gave them, they then developed the funding model. The funding model, which I'll get to a little bit more in depth in the following slide. What's important about the funding model is that once we had all of the elements into that model, we had the counties validate that data. So they had to provide data to North Highland in order for the funding model to be created. When that funding model was complete in draft form, then we shared that with counties and said, okay, gut check time. Are we on the right track with what the model is telling us at this initial stage? Because we still have opportunity to pivot and adjust. All right, so I'm going to go ahead and go into the specifics of the funding model. Here, I'm going to talk about what the funding model is and what it is not. So the deliverables on the screen, these are all the specific documents that North Highland was able to provide to us, and that was done by June 30th. As you can see, by November 1st, we will have that final report and funding model submitted to the General Assembly. But I'm going to first talk about what the funding model is. So the funding model calculates the total amount of funding counties need to administer public and medical assistance programs in the state. The model is based on actual inputs, and those inputs are county costs. So part of that data collection North Highland did was, what are you spending to administer these programs currently? And this was not across all counties. With the funding we actually had to target 10 counties to be the model counties in which we collected this data. In addition to the actual costs, we were able to pull data from CBMS, the Colorado Benefits Management System. That's a system used to determine eligibility on the actual tasks that are completed. So when we say applications, how much of those are actually done, and how much time does it take to do those applications? Let's see. From there, they use all of that information to calculate a total number of FTE that are needed across the counties for the administration of these programs, and that includes things like what salary are we paying, the benefit, fringe costs that are included in that, operating costs, vacancies, overtime costs, or contractor costs. Like all of that was used to input into the funding model. The data that we collected, though, like I said, is from 10 counties, 10 model counties. That included 3 large counties, 4 medium counties, and 3 small counties. And that was all cost and task data from calendar year 2023.
Hey, Josh, sorry
yes.
to interrupt you, but you touched on it and there's a question in the chat. Are you able to share which 10 counties provided their information to inform the funding model?
We absolutely can, but that might need to be a follow-up because I don't know if I remember off the top of my head if Shelly looks like she can pull the list. Okay, so we'll get that list. All right. So the model, so all of this cost data, task data, all of that is sort of input into this funding model, which is a very complicated and robust spreadsheet. And then the model extrapolates to all counties from that 10 model counties that was selected. And that's based on the actual volume of work in those other counties that were not the model counties. One important thing to note is that the 10 model counties, the selection of those were related to performance, actual performance. So performance based on federal or state metrics, and that was things like, how is the application timeliness? What is your call center average speed to answer? Things like that were all used to input into the funding model, and were what we use to determine, in collaboration with our county reps, who the 10 model counties were. The important thing about that, though, is that the funding model, in using all of this information that's input into the spreadsheet, determines the actual amount of funding needed for counties to administer these programs based on meeting all of our federal and state performance standards. So, we have a requirement for processing Medicaid applications in 45 days. We want those to be done a certain percentage of time, always on time. All of that was input into the funding model. Luckily, the intent of the legislation and how the funding model was produced was actually to be flexible and adjustable. So we know policies and tech systems change with time. So the funding model that is being produced for this year may not be valid again in 3 years if federal policy changes, federal administrations changes, our systems changes, right? So the model was designed to be fluid. As data adjusts, so adjusts the funding model itself, in order for us to see what that true need for funding is across the counties for those programs. Now, it's also important to note what the funding model is not. So the funding model produces the total amount of funding that is needed for these programs, but the funding model itself is not an allocation formula. So it does not produce, here we need 100 million, and then County A gets 10%, County B gets 5%. That sort of allocation piece is not dictated by the funding model. It actually spits out a number for each county, but we're not required to use it. So that particular piece of how that big number is divvied up will still be a conversation and a process through our County Administration Allocation Committee that meets annually. The funding model is also not a workload analysis. So folks here, workload study, oh, that's what we're doing right now. This is actually not a workload study. It did not analyze workload. It just looked at the total amount of funding needed to administer these programs. And Katie, I'm actually not paying attention to chat, so if you need to flag me or stop me, feel free to. Additionally, the funding model does not influence our closeout process at the end of the fiscal year. So when we close out at the end of the fiscal year, there's a specific process in which we move funding from an underspent county to an overspent county. Like all of those specific accounting procedures are not changed or impacted by this funding model. All right, so let's see. I think the important thing to note here to end with is how our county engagement looked in this particular piece. I have to give a huge shout out and a thank you to our county reps that sat with us on a committee. Well, pretty much for the past sort of 2 years that we've been doing this work. But thank you to a whole group of folks from, I mean, I think there's some specific folks I'd call out, like Katie from Adams and Jamie from Weld, Karen from Grand and Jody from Rio Grande, like lots of diverse representation there. Some folks that I didn't mention, but thank you to them as well. They were along this journey with us every step of the way. So as we were meeting with the vendor, making adjustments to the process, hey, here's the 10 model counties. What's your gut check on this? Hey, here's the data as it produced in the first iteration. Time for the gut check. All of that was done on this journey together. And so just super appreciative for those county reps taking the time out of their regular workday to meet with us on a regular basis. We were meeting weekly or bi-weekly at least in order to advance this work. So thank you to those folks. Super helpful and couldn't have done it without them. So the funding model. Ultimately, this is a decision-making tool for the General Assembly. Neither HCPF nor CDHS have our own authority to say, here's what the funding model it produced, so we're going to allocate this amount. We run the funding model this summer, produce the final report and the funding model for submission to the General Assembly November 1st, and then it is incumbent upon the General Assembly to decide what steps they're going to take or not take with the information we provided them. So I think it's important to note here, as Katie said at the beginning, this is obviously a high priority for our county partners, very much so for the state agencies. Would love to make sure that we're collaborating on messaging and all of that good stuff, that when that decision-making tool is available to the General Assembly, that we're both saying the same thing to our General Assembly, to our public, to our interested community members, that this is a critical tool for us to improve our system, ensure members and clients are getting the services they need in a timely manner. So from there, I'm going to go ahead and go next step. I talked about over the summer, we're drafting and I say summer, it's actually towards the end of summer already. So summer, early fall, we're working on the draft report. We have shared the outline of that draft with our county reps for their feedback. So we will be working on fleshing out that final report, have to get it to governor's office for review prior to that. So once that's completed, then we will share an embargoed copy with the human services directors in October with governor's office approval. That's still outstanding. That final report is due November 1st, as I said, and then that critical time then starts. So from end of November through March, that is really when the General Assembly will be considering what action they do or don't take based on the decision-making tool that we provided them. That is just for the phase 2. So you did hear from Shelley that this is an ongoing expectation now. So we cannot create a funding model and then just leave it at be. We will start to contract for our annual updates next July. And so the funding model updates will occur every 3 years. And then from there, we will submit those funding model results to the General Assembly. And each time we submit it, it'll be that decision-making tool for them to determine exactly what level of funding they want to proceed with. And of course, we will involve our county partners in all of those steps where we can to make sure that you guys are alongside us in those conversations. And with that, I will stop for questions. And then before we go to general questions, Shelley, anything I missed or anything you want to add?
No, thanks for asking.
And Katie, we're now open for questions.
From Commissioner Levy in the chat, will the funding model adjust for recessions and increased demand for services?
That is a great question. And Shelley, feel free to jump in. I'll take a first stab at that. So the funding model uses the CBMS task data. So that's the actual work that's completed in the system. So as a recession occurs or an increase in demand occurs, the number of tasks that the county would complete would also increase. Therefore, when the model is run in the next iteration, it would pick up that increased task level and say, okay, there's been an increase in tasks. There needs to be an increase in funding to go along with that. I do also want to be clear, though, that it can also produce the opposite. So if we see efficiencies or changes in federal programs where our caseload changes, the funding model will also pick up that decrease in task data and say there may be a decrease in funding that's needed in the future. Now, we don't know if and when that bridge will ever be crossed, but the funding model is intended to pick up the variation in how much tasks are being completed.
Go ahead and follow up, Commissioner Levy.
Is it okay to do this live?
Yes,
Okay,
please.
thanks.
Even better to do it live.
Yeah, I just didn't know whether this was all enabled. Yeah, just to follow up on that, it sounds, and thank you for this whole presentation. It's really helpful. But it sounds like the funding model, if it's done, and I am concerned about when there's a spike in need, and that the funding be available. It sort of sounds like it'll be lagging, though. If it's based on that CBMS task entry as opposed to anticipating based on financial forecasts, is there any way that it can be done in a way that it would not be lagging what is actually being entered into CBMS in these times of increased demand?
That is a great question, Commissioner, and thank you so much for that, because we also had that sort of same conversation around, well, it doesn't really anticipate the future, and that's really hard to anticipate the future, right? Like, we can say there's a recession, but do we know the depth of the recession? Do we know which part of the economy it's going to hit, right? So, like, the most recent COVID recession really hit those low-income folks hard, but sometimes it's the opposite. Sometimes the higher income folks are hit hard. At this point in time, the way the model is built, it is that sort of lagging indicator. But HCPF and CDHS are trying to determine in future years how we can build something out in the funding model to anticipate, but understanding that that would require additional funding from the General Assembly to have a vendor conduct that analysis to do that sort of update to the funding model. Like, those are our next steps. But until those next steps are done, it is that sort of lagging indicator. Shelley, anything you want to add?
No, I think that's exactly right. And, knowing what the budget cycle is for Colorado, and the JBC will have this information to be preparing for a fiscal year 25-26. I think that is one of the difficult things to navigate with this.
I'll keep reading questions in the chat, but folks, feel free to use, I know the raise hand feature has suddenly kind of hidden in Zoom. Really quick though, and Josh, I may have missed this as well, but Lexi asked the same question about what the funding model is showing for right now and how much funding overall is needed. Are you able to start sharing that, or do we have to wait for the report to be completed in November?
Shelley, I don't know that off the top of my head the number, so we would probably have to follow up. But Shelley, do you want to add anything on that?
Well, we also have support on the call from Samantha, and I'm wondering if Samantha can pull up those numbers to be able to share while we answer a couple of the other questions. That works. One of the other questions too, I think that we skipped over, was about Summit being a small or a large count, or excuse me, a small or medium. And Josh, you'll please correct me if I'm wrong. So I think there was discrepancy on CDHS considers it Summit as a small, and HCPF considers Summit as a medium, but we went with a small for the purpose of this report.
Got it exactly right. So that sort of designation, or small, medium, large, is based on caseload size. So there was a difference in the Summit County's SNAP versus Medicaid caseload. And because CDHS was the contracting state agency, we went with CDHS's definition of Summit as a small county. Even though for Medicaid, based on Summit's caseload, they would be considered a medium for us. Really, though, it didn't have any impact on the outcome of the funding model itself.
Yep. And we had extensive conversations too with Summit about that. And I believe we settled on that, felt comfortable how we came to it. The recommendations from phase 1, Samantha, thanks so much for dropping those into the chat. And when we follow up with the materials in the report, there will be more explanation than just the headlines there. Did we answer Lauren Harvey's question? And excuse me if it's Commissioner Harvey. Does the funding model report indicate what the specific tasks are in CBMS that inform the funding model? And does the model also include work that's not considered a task in CBMS? Josh, do you mind talking a little bit about that?
Yeah, so it does include, it does rely on CBMS for a lot of that task data, but it did include elements that are not reported in CBMS. So for instance, for our large counties, it included call center data. Call center data is not tracked in CBMS. That's tracked in, well, about 10 or 11 different county systems right now. So HCPF collects that call center data on a monthly basis anyways. And so we just provided that to the vendor in order to capture some of that work that occurs outside the system. But there was also, I don't want to say there was task data collected, but they did look at, in the cost analysis, things like, lawyer costs for any sort of lawyer services that have to be provided for the programs, quality assurance costs, claims investigation costs, like all of those were input into the funding model. It just wasn't there. There wasn't a CBMS task data point to go along with those. And
I think we're caught up on the chat, Josh. I got you because I know you're sharing your screen. And then, so Summer with your hand up.
Yeah, thank you. And good to see you, Josh. And thank you both for this presentation and making it available to the county commissioners. This is really helpful. I had a couple questions around when CDHS and HCPF have made their ask in terms of the next legislative session. Are you hoping that, do you have, I'm not sure you can answer this. Do you have confirmation that that total of about 30 million would be included in the governor's budget? Are you thinking of a different strategy? And also, as you look at the 235 initial funding model, are you considering including implementation of these phase 1 recommendations or including any of these practices that were recommended, like at the 3 quick wins or the 5 areas for transformation, as we may see some cost savings in implementing some of those? So just curious where you are all on that. And I think, yeah, those were my major questions.
Kelly, you want to take a stab?
Yeah, of course. So thank you so much for the question. We are in the middle of our budget cycle right now and preparing and working with the governor's office. The state agencies, as we work through our budget, are not able to share the contents of the budget requests or things that we are working on. We are taking all of this information into consideration, though, as we build a budget and recommendation for the governor. We also recognize that this is a really tight budget year, and what we can do with this is to be able to say, to deliver on the ask of Senate Bill 22-235. The factual results of the model are dropped in here into the chat. Samantha provided that, and that is what we're able to do. But Josh, do you want to add anything else?
I was just going to say, whatever it is that does come out when we are able to share, it is critically important that we speak in a united voice to the General Assembly of these were what we identified as the feasible next steps, and get all of the support we can around that, because as Shelley said, it's going to be a tight budget year, and it's going to be, fighting for what's left over in the budget. And so it's important that we all speak in that unified voice to say, this is what we need in order to better serve our clients and members.
And I think the other question, the other part of the question too, was regarding the first phase of the report and the recommendations there. That's too part of the things that we are thinking about as state agencies. How can we deliver on those efficiencies, as well as provide the evidence of what the model is suggesting, and being able to give the JBC that information to make decisions. Lexi, I don't think right now we have a budget number for what it would cost to implement the recommendations of the first phase.
With the exception of, at least on the transformative recommendation 2, which was the unified workload and document management system, that has been separately funded, and that funding approval is through, I believe, 2026. So at least for the joint agency interoperability, the JAI, that is funded.
Thanks, Josh. I know that you all had identified how many staff you would need to implement each of the recommendations also, but so I was just wondering if you all had consolidated that the number of FTE somewhere, and what that total cost would be also. But it sounds like.
Yeah, I don't think that is something that we have available at the moment, at least on CDHS side.
Same for HCPF. Although I will say, Lexi, one thing that came out of our working session with counties, the in-person working session a couple weeks ago, was that we did want to schedule another in-person working session with you all for post the November presidential election, but pre-Thanksgiving. And that would be for us to all collectively do a deep dive into, well, any potential federal administration changes, but also what exactly are the results of our work on the internal budget process. So some of that might answer your question at that point in time. Yes, Jody.
Hi, Josh.
Thank you, Jody, for all your work.
You're welcome. Sorry, we have some issues. Just a second.
Okay, I was like, maybe it's me.
While Jody's figuring that out, yes, she was one of our very crucial partners in phase 2. So we've valued your partnership, Jody. I hope you can hear us.
We're all waiting with bated breath for Jody's tech issues to be resolved.
We should all be clear for Jody's excellent question, I'm sure. She always has the best questions.
She does. And one thing, kudos to Jody. Boy, does she know the finance side exceptionally well. So it was so helpful having Jody along with us on that journey. Because many of us are program folks, right? Not necessarily in the weeds of the finance side, and Jody has been so helpful in that. It looks like maybe you resolved your tech issue.
So Josh, can you hear me now?
Yes.
All right, sorry for the echo. I'm in Alamos and we're at a director's meeting and they can't get the other computer muted, so I moved. One of the things I just wanted to point out that this is a work in progress. And I think counties, the two things that we really still need is a salary analysis at some point and a workload study at some point. So just making sure commissioners are aware that, this is a great start, but there's still lots of work to do and that we may need to, do additional things. But with tight budget years, we may not have funding for some of that stuff, but just wanting to put that on the radar of all of the county commissioners.
Yes, thank you, Jody. And as we said in our county task group meetings, this is not a sprint, this is a marathon. So we are barely, 1/3 of the way through of the marathon with the first funding model release. But yes, I mean, one big question and that is outstanding there is, what should eligibility technicians be paid? The job looks so significantly different than it did 10 years ago. On the Medicaid side, I know our long-term, our technicians are dealing with more long-term services and supports clients. So those folks who need their hand held through the process, who need intensive one-on-one support. And what should that work be paid for? What should we be paying our workforce? So that is still an outstanding question. Although I will say in the funding model, we didn't say what was needed, but we did create the funding model to align the salary with the highest paid salary out of the Model 10, which I think was like a, I want to say a 50,000 number, something like that. But is 50,000 the right amount? That's an open question, and that's work that we still continue to have to do. The other component that Jody talked about was the workload study piece, which Jody, I think you're talking about the time study, right? I think yes, but we'll let Jody jump in a second. One element of the funding model was how much time it takes to do an application or a renewal. And we last did that sort of time study analysis back in 2016, 2017. And that was before CBMS transformation, which moved us into Salesforce for CBMS. So it is now time for us to say, okay, it's time to relook at how much time does it take for a technician to process an application from beginning to and use that updated minute study and put that into the model. It didn't have an impact on the overall amount of funding in the model. It just was used as a sort of comparative analysis across counties. And then I think we could go to Lexi.
Well, Josh, you sort of answered my question just now, I think. But, you know, in the beginning, you mentioned this is not an allocation model and this is not a workload study. I think it's pretty clear what it means for this not to be an allocation model. But in terms of it not being a workload study, how would you distinguish this from a workload study, which I think you just did in terms of talking about a time study? But how could you anticipate an updated workload study affecting the funding model?
I think that's a great question, Lexi, but I think part of the problem is that we don't all have a common definition of workload study. So some folks were calling this a workload study and we're like, no, this is a funding model and an assessment of best practices. What would you define a workload study as?
You're not allowed to put the question back on me. I'm not sure. You know, I think of workload studies generally as capturing the work before the individual counties and how much it truly costs to do that work. And so I often see a funding model, truthfully, as more of a projection for what it actually, in an ideal scenario, what it would cost if you were sort of able to fund a system fully and have it function the way that you want it to. So I guess that's how I distinguish it, but I see this one as somewhat of a combination of the two.
Yeah, I was actually going to agree with that, Lexi. It's the funding model, although it's not a workload study, does tell us based on previous year's data what that funding need is related to FTE, right? I think what you want to see, and it was kind of touched on, was what is that projection going forward? So as systems changes, policies change, a recession comes, like, can we project forward to capture that? So I don't know. I think this would be further conversation with HCPF and CDHS and our county partners. I don't know necessarily if a workload study is needed so much as our continuous improvements to the funding model to capture some of the elements that you're talking about. And Shelley, I don't know if you want to add anything on that.
Yeah, I agree. And I think that's the nice thing about every year we are revisiting the funding model and can make those adjustments as we are partnering and working with the counties and both agencies to further define that.
Anything else, Lexi, on that?
Nope, thank you.
I could see why folks started to call it a funding model because based on your definition. it kind of was that, but it just wasn't called that specifically. So, but the intention was, I think, the same as what we would theoretically want from a workload study, which is what resources do we need to do the work that we've been tasked to do? And not just tasked to do it well. So I want to reiterate that too, is that in the funding model, we did fund the model to high levels of performance. So counties have a standard now of 95% timely processing, right? You have to do your applications 95% of the time within the federally required time frame. We set the funding model, and there was more money produced in the funding model to say, what do we need to do to meet that federal requirement 100% of the time? We want everybody to meet that requirement of the federal regulation. Now, understanding there's situations and circumstances that would prevent that. Members didn't submit what they needed to, their system issues, that sort of thing. But what we didn't want to do was fund the system as it exists today. We wanted to fund the system as the high level performance that we wanted to see in the future. Another example of that is our call center wait times. So call center wait times across the big 11 counties vary widely right now. We said we want the funding model to tell us how much funding counties need to answer the phones in 5 minutes or less. The 5-minute average speed to answer. And understanding that small and medium counties don't have call centers, what additional funding and staff do they need to meet whatever their business process is to make sure that they're able to answer calls from members timely, return voicemails, staff the front desk, that sort of thing. All of that was included in the funding model. Other questions or comments? Katie, I think I'll turn it back to you unless Shelley, you have anything to add?
I just want to make sure, Katie and commissioners, that you feel like the questions that you had proposed, that we were able to provide that additional detail, because we certainly want to make sure you walk away feeling informed about 235, what it set out to accomplish, and what those deliverables were and are, what the counties, how they've been participating, and even for the state agencies to know if there is more desire for us to, if the counties are not feeling like they've been involved in the second phase in any capacity, it'd be great to know, so we can pivot if needed. But I think that we've done a really good job partnering with both CCI, CHSDA, and our counties on this project. But if that is not the case, we certainly would love to hear it.
I welcome feedback from commissioners, but yeah, state partners, I really appreciate all of the partnership and all of the really hard work I know you've done with the directors. And thanks for kind of taking the time to help kind of level set where we are with the commissioners, knowing that we have a lot to look forward to coming forward. And thanks, commissioners who are providing some input in the chat. I think on we went through a very, not exactly the same, but a slightly similar exercise on the child welfare allocation side of having a workload study and an updated funding model. And it's funny to talk about those definitions, Josh and Lexi, because those are very different definitions over on the child welfare side. But just to the extent I am able to help kind of provide information to county commissioners on the results of that funding model and what that could maybe potentially one day look like if we are fully funded, I think would be really helpful looking forward as well.
And Katie, to that, the numbers that Samantha put in the chat, that will be what is presented and kind of the biggest takeaway I think that people will want to scroll down to and look at when the report is done and when the JBC has it in its hands. That those are the numbers. What did the model produce? These are the numbers. So what we've provided in the chat is what you will see in the report.
That's great. All right, well, I think that covers everything from me, but I guess last call for questions, comments, concerns from the group. Commissioner Glover.
Hey, I just wanted to say thank you. It's very informative. There's a lot of stuff that is way beyond this guy's head, but I appreciate all the work on here. And I want to give a shout out to Jody because she is one of the outstanding people we have in the state to watch out for our county. We're very, very fortunate to have her here. So, and thank you all.
Well, thanks so much for the partnership. And again, thanks for reaching out, asking, and giving us this opportunity. I think that is going right back to one of those phase 1 recommendations. How can we be better partners in this work? And we appreciate the opportunity.
Great. Well, we'll end it on a wonderfully positive note. Thanks, everyone. Enjoy the rest of your Monday.
Thanks all. Thank you, Katie, for coordinating.
Yeah, happy to. Anytime.
Have a good one.
You too.